Well, time now for this week's medical moment. For the first time, COVID-19 hospitalizations are higher for young people than for people 75 or older.
Dr. Melody Petty from USA Health, Children's and Women's Hospital, joining us tonight. Thanks for being here, doctor. And can you tell us why we're seeing this trend?
Thank you so much. So although the overall number of COVID-19 cases in the U.S. has decreased, the proportion of new COVID-19 infections attributable to children is going up. And children that are infected with COVID-19, they usually do have a milder course, but for some children, infection with COVID-19 can mean severe illness, and also with the condition associated with COVID-19 known as multi-system inflammatory syndrome in children. As a pediatrician that works in the hospital, I have personally taken care of patients that have been transferred to my service with these two conditions after spending weeks in the intensive care unit.
Wow. That's scary to hear, because most people think if my child gets COVID, they're not going to get a bad case, and therefore I'm not going to vaccinate my child. But I know, just listening to you, you probably are encouraging as many parents as you can get that vaccine, because not all cases of COVID are mild.
That is right, especially like I was saying, being firsthand and seeing those kids that have battled for their life, and it can be very, very serious. And the thing is, you never know how it's going to be. So now that we have the Pfizer vaccine available for adolescents 12 to 15 years of age, I am so excited, because it gives us the opportunity to protect this age group against getting the COVID-19 infection. It gets us a step closer also ending the COVID-19 pandemic, and get us closer to going back to all of those activities that we missed due to COVID-19.
This is the last week of school. Some parents, doctor, might be saying, well, I'll just wait till the end of the summer to get my kids vaccinated. Why is now a good time?
Now is a good time because school has ended, and really we're 5 weeks away from the 4th of July. With the COVID-19 Pfizer vaccine, it's going to be those 2 doses given 3 weeks apart, and it's the same dosage as for the vaccine that's available for those that are 16 years and older. So really, you can go into summer vacation with your children that are eligible for the COVID-19, knowing that they're fully vaccinated, and going into the upcoming school year also being fully vaccinated. So I would encourage everyone, if you have an eligible child that can get the COVID-19 vaccine, please do it.
All right, Dr. Melody Petty from USA Health, Children's and Women's Hospital, thanks so much for joining us this evening.
Thank you much for having me.